Welcome to another edition of A New Me, your weekly consultation with the Washington, D.C. area's best doctors and professionals. Our guest experts help you learn about the latest medical advances and procedures by providing you with the real information necessary to help you eliminate the dangers of making the wrong medical and cosmetic enhancement decisions. Get ready for your consultation. Coming up, we will be on location at Lifetime Smiles Family and Cosmetic Dentistry in Haymarket, Virginia, discussing the benefits of dentistry and how they can give you the healthy and beautiful smile you've always desired with one of this region's top dentists, Dr. Sina Reangber. Dr. Reangber received her dental degree from Howard University Dental School. She is a member of the Northern Virginia Dental Association and the Academy of General Dentistry, among others, and is widely recognized as one of this area's top dentists. Welcome, Dr. Reangber.
Thank you.
Oh, it's our pleasure to have you on, your first time, in fact, on our program.
Yes.
We've got a lot to talk about. We've got a couple of patients that are going to be joining us a bit later in the interview. But I wanted to begin by asking you if you can please tell us what are some of the benefits that dentistry offers us.
Absolutely, Rocco. Thank you for having me here. Some of the benefits of dentistry, of course, is we want to keep our patients, help our patients keep their teeth for the rest of their life. Obviously, nowadays, patients are living longer. With modern technology, they can have implants and, crowns and things so that their teeth can last longer.
Yes.
Our goal, of course, is to help them keep what they have. We don't like pulling teeth just because, it's broken or it has a cavity on it. We want to try to have them keep their teeth as long as they can so that they can function, they can eat, they can talk, and, have confidence when they speak.
What would you say are some of the more frequent dental problems that you see from patients that come to your practice?
We see a little bit of everything, but most commonly what we see are cavities or dental decay. We also see a lot of patients who have some form of gum disease, whether it's gingivitis, which is the beginning of gum disease, all the way down to more severe advanced gum disease. I would say probably 6 out of 10 patients we see have some form of gum disease. It's
that common, that prevalent.
It is, it really is. And it's, we see it some in younger patients, a lot more in older patients. Again, it's partly because of the older age diseases. Patients who are diabetic are a lot more prone. Patients who take medications are a lot more prone. If you have family history of gum disease, smokers, all these are factors that contribute to gum disease.
Now, how would you treat this problem and some of the other problems?
Well, when it comes to gum disease, what we do is we would start with a full thorough exam. We check measurements around the gums, of the gums around the teeth. It's a very thorough exam. We take a full set of x-rays to determine the amount of bone loss that there may be.
Sure.
And we start with what's called a deep cleaning or scaling and root planing.
Okay.
A lot of times patients have heard of it as a deep cleaning. And what that entails is it's typically a 2-session procedure. We have them come in, we anesthetize them and go and really clean the root surface of the teeth and the tartar and plaque that's underneath the gums. There is space between the tooth and the gums, and that space should be anywhere from 1 to 3 millimeters. That's average, that's normal, it's healthy. But when there is infection and disease, those pockets become deeper. Bone is actually lost due to the bacteria that releases toxins. It actually causes the bone to go away. It's like the bone is just melting away around the teeth. And that, if it's not treated, can actually cause patients to have a lot of pain and sensitivity, even infect the roots of the teeth. So the nerves of the teeth become infected as well.
Very interesting. And as far as some other dental problems that you see here and some treatment options that are effective for those?
Yes, dental caries is a lot. We see a lot of dental caries. And what we've noticed in our practice is a lot of patients who have old silver fillings. There, obviously silver was very commonly used in the past, not as much now.
The old mercury fillings,
Right,
things like that?
Right, the amalgam fillings.
The danger that's associated with those back
Right.
then that has come to light in the recent years.
Exactly, and not just that, but they actually have a wedging effect in the tooth. And nowadays I see a lot of my patients who have these very large silver fillings with cracks in the teeth. The teeth have multiple cracks, multiple fractures, and decay just forming around it. And patients always ask me, well, it's not hurting.
Yes.
It doesn't hurt. How come if there's a cavity, it doesn't hurt? And I always say, well, it's a good thing that it's not hurting. That means that you're not going to need a root canal or the tooth isn't broken or cracked. If they wait till it hurts, they're usually going to need more treatment. So what we like to do is get them treatment, any type of restoration, whether the tooth is going to need a ceramic restoration like a crown or an onlay, or even just a tooth-colored filling to take care of the cavity, get the cavity out, and help the patient save that tooth.
As far as the results from these treatments and other treatments that you provide here, what are we looking at as far as getting that new smile and feeling great again about ourselves, which sometimes we lose through the course of life when our smile goes?
Right. I've had patients that have called me or told me that, I had this just headache on this side of my face, and they've had it for so long that it's become very normal. And when we take care of the gum disease or the decay, they feel better. I've had patients who have had chronic gum disease for years, and they've always had a low-grade fever.
Yes.
And when we treat them, they actually come in feeling better. And you can just tell that they're a lot livelier.
Yes.
They feel better overall. They, start taking care of themselves better, exercising and getting their nutrition better. So, a lot of times people may think that it's just teeth, but it's the opening. Your mouth is the opening to the rest of your body. And it's very important to take care of what's going on in there.
No, that's very well said, Dr. Reangber. I think that hits it right there as far as the importance of our mouth and making sure everything's right in there, because that does basically open up to the whole body. Great point. We're now going to meet a couple of patients of Dr. Reangber. Welcome, Steve.
Thank you. It's good to be here.
Oh, it's our pleasure to have you with us today. We always appreciate it when a patient takes time in their very busy lives to come down and share some of their experiences with us. And on that note, I wanted to begin, Steve, by asking you what dental problem or problems were you experiencing prior to coming to Lifetime Smiles?
Well, I've had several dental problems in the past. I've had an extraction, I've had a root canal, I've had some fillings done. Like most people, I'm terrified of the dentist. So
it's one of the biggest fears out there, right?
Yeah. So what you end up doing is you delay and delay and delay until it becomes a problem, and then you go, and then it is such a problem that you don't want to go back again and do it over again. So I really try to avoid the dentist whenever possible. In the past.
So like a lot of folks, but as you just said, at the same time, we have to go to a dentist, all of us, on a regular basis, because if you don't, then small problems can become big problems and can affect our lives in so many ways. So then what happened? You came here to Dr. Reangber, and what happened next?
I had some fillings that needed to be done. I actually had a crown that needed to be taken care of. Matter of fact, just last week I had the temporary done, and I'll be back next week to have it finished.
Very good, very good. And how's your experience been here with the practice?
Well, I got to tell you, as I mentioned before, I'm terrified of the dentist. One thing I like about Lifetime Smiles is when you get here, you're in a very warm and inviting environment. You come in, and as you can see, this is the office that you come to.
It's like a spa. It's so beautiful and tranquil. I mean, I walked in here and I got a very soothing, comfortable feel.
Absolutely. So the anxiety immediately gets toned down, and then a lot of times when you go to the dentist, you're left waiting for forever, letting that anxiety build. Well, I've not had that experience here. When I come in, usually within 5-10 minutes, I'm taken to the back and work begins. So again, the anxiety level doesn't have as much time to build. And then when I get back there, the chairs in this place, they have massaging chairs.
Oh, yes.
They've got TVs built in. all the things that kind of distract me from the fear of what's going to happen in the next 5-10 minutes.
Haven't things changed?
Oh, absolutely.
Over many years ago.
Oh, it's amazing.
When we used to go to a dentist.
Oh yeah, it's crazy how different the experience is. It's not the old days of the wild, wild west anymore.
That's right.
You know, you come in and I tell you, Dr. Reangber is excellent about going over what it is that she's going to do before she does it, so you're educated, you know what to expect. I don't think I've ever been to a dentist that cares as much about my fears, my pain, as much as she does. And so she does a great job of relieving that anxiety.
Well, that speaks volumes because, as you just touched on a couple of times, a lot of folks, not only yourself, but millions of folks out there have a big fear of going to a dentist. To know that there's a place here at Lifetime Smiles that serves the community, where they really take care of you, they really treat each patient like a family member, from what we've heard and from our research, and you're here obviously as another testimonial for that.
Absolutely.
And on that note, as far as the viewers out there go, and they're watching right now, what would you be telling them?
I tell them, if you want to come to a place that's going to take care of you, relieve your anxiety, as I mentioned before, do an excellent job, and then pretty much have a painless experience, this is the place to come.
Well, that says it all. And on that note, I'd like to thank you, Steve, for joining us and being a guest on our program.
Thank you very much.
Welcome, Muslim.
Hi.
It's our pleasure to have you on as well. And as I just told Steve a few minutes ago, thank you for coming down, because we know how busy patients are in their lives, and to come down and share their experiences certainly help all of us better understand what we're talking about and the options that are available. And on that note, I wanted to ask you, Muslim, if you could tell us what dental problem or problems were you experiencing that brought you to Dr. Reangber?
The problems I had was mostly due to some crowns I had. Prior to coming to Dr. Reangber, I had another dentist, which were not done correctly and they need to be replaced. So because of those crowns, I had a lot of pain and discomfort, especially while I'm eating. My teeth were very sensitive and I had issues with that.
So then you came here, Dr. Reangber took care of all that for you. Have you had any other dental treatments done by her?
Well, mainly, that was a lot of work because all the crowns had to be replaced, but also she did some bone grafting on some of the teeth that I was losing bones. And the addition to that, she did a very thorough, deep cleaning job, which helped me tremendously.
And I take it you're very pleased with the results.
I sure am. Before I came here, I had all the pain and discomfort, but now I feel 100% better.
Oh, that's wonderful. I'm so happy to hear that. And for the folks out there that are watching right now, what would you have to tell them about Lifetime Smiles and Dr. Reangber?
Oh, it's a very professional outfit, and the people who work here are great. And Dr. Reangber is one of the best I've worked, that I had a patient off, because I've been to several dentists. And she takes her time, she's very thorough, and she's just always smiles, like the name of her office. And it's been great.
And they really take care of their patients over here like family.
Yes, they do. They do.
And on that note, I'd like to thank you, Muslim, for joining us and being a guest on our program.
Thank you.
I appreciate it. We're now back with the doctor. I must say, both Steve and Muslim were very pleased with the results, and a lot of positive stuff to say about you and your practice here.
Thank you.
And especially in Steve's case, he made a great point. There are so many folks out there that have a big fear of going to a dentist. And to know that you alleviate that fear, because we know we have to go to the dentist, otherwise major problems will be coming down the road. So I thought that was really quite a example of a patient that he's now not only not fearful of coming to the dentist since he's been coming to you, but he actually enjoys it and looks forward to it.
Right.
That's
absolutely.
wonderful.
Thank you.
Now, who would you say is a typical candidate for your practice and that you see a lot of out there that can benefit from the different treatments that you offer?
Well, we do general dentistry, so we see kids as young as 2.
Oh, pediatric dentistry as well.
We do. We have a lot of younger patients. Then we see their parents and even grandparents. So we see a range of patients, you know, I think it's from age 2 to like 90, in their 90s.
My goodness,
yeah.
you're covering pretty much the whole gambit
Right,
there.
absolutely.
And how long would you say some of the results last? I know it depends on treatments and particular patients, but for instance, on the cosmetic side with the porcelain veneers and how they help enhance our smile, what type of results are you looking at there?
You know, with technology, everything has changed tremendously. The newer bonding agents and adhesives that we use, they've become very, very good. When we bond it to the enamel, in some cases we don't have to prepare the teeth as much. So when it's bonded to the enamel, it's much, much stronger. Now again, patients have to realize that there may be some limitations in what they can do. If they're grinding their teeth or chewing on ice and pencils and things, you know, that's gonna put more stress on their restorations. But in general, they last a very long time. And they have to remember they have to come in for maintenance.
Yes.
That's very important, whether it's fillings, crowns, the gum scaling and root planing. Anything that we do has to be cleaned professionally. We have to go in and monitor and make sure that everything is still stable so that it doesn't come back. A lot of times we can treat it very early if we see any cracks in the teeth or decay around the teeth. It's early prevention, you know, and keeping their teeth as long as they can.
Yes, you're absolutely right. Prevention is a big part of all this. Now, we've literally only got a few moments left, Dr. Reangber, and I wanted to ask you before I let you go. You and your practice, Lifetime Smiles here in Haymarket, Virginia, have certainly developed and established a reputation for excellence within dentistry. And I wanted to ask you, what would you say helps separate you and your practice apart from many of the others in this region?
I think one of our main goals in our office is to try to help our patients keep what they have. Their cosmetics, yes, it's a big part of dentistry, but a lot of times patients aren't as interested in the cosmetics as they are in retaining what they have. And that's our goal, to try to educate our patients in their different options. My goal here is to have very clear communication with our patients. That's very, very important to me, to make sure that our patients are educated in what their options are, and so that whatever decision they make, it's an informed one.
Oh, I think that's very, very important indeed. And we heard from some of the patients that we interviewed today and from others through our research that you all really care about your patients. You're like a big family over here.
Absolutely.
And the patients obviously are extremely happy with the results. And on that note, I'd like to thank you, Dr. Reangber, for joining us and being a guest on our program.
Thank you very much.
It was our pleasure.
Thank you.
Love to have you back on in the future.
Sure, absolutely.